I'm very excited to start with our first guest, Dr. Zachary Pallas, who's the medical director of the Hebrew Home at Riverdale, at River Spring Health here in New York, and his colleague, Rabbi Simone Hirschhorn, who's director of religious affairs at the Hebrew Home at Riverdale. And the reason why we're having Dr. Pallas and Rabbi Hirschhorn on the program is that Medicare is moving towards covering what are called end-of-life discussions, and we're going to talk about why these are important and how to start to have this conversation for yourself or loved ones. So, Dr. Pallas, Rabbi, thank you so much for joining us on the program.
You're welcome. Thank you for having us.
Okay. So, Zach, why don't we start with you? And for our listeners, you work at a nursing home, and that is a subgroup of generally older people who, sort of by definition, are not able to live in the community for the most part. And so that seems like a group where these discussions are important. Mm-hmm. So maybe you can talk about how you deal with this topic in that group at the nursing home and with families.
Sure, Mike. So, in general, it can't be understated how important it is to have the discussion about advanced care planning with individuals of any age group, but particularly within the nursing home, since, as you said, we do deal with the older population, and they've already come to a point in their life where they may be approaching end of life, or that's something which is...
Well, certainly their remaining life expectancy is not a large number anymore.
Sure. This is an appropriate time to have that discussion in terms of when decisions need to be made in terms of end-of-life care, that while they're able to make those decisions, that we're able to get them to articulate what they would want, what they wouldn't want, in terms of how the future would look for them. And just, it's a matter of what we refer to as informed decision-making, that they understand in terms of issues such as do not resuscitate, issues in terms of whether or not they would or would not want feeding tubes or various interventions, that we have that discussion, so we're all on the same page, the patient, the patient's family, and the physician, in terms of what the patient would or would not want.
Okay, so thank you for that summary. And Rabbi, I think the reason why we have you on is, of course, this is an area that religious leaders and advisors and counselors and rabbis and priests, etc., have since antiquity, right? Since the counseled people.
Right.
So in the discussion end of things, sometimes the religious leaders have more experience than the doctors. So we have to come together, the doctors and the religious leaders, on this.
Mm-hmm.
So maybe you can give a little bit about your perspective, because I don't know, Zach, you work in a nursing home, but as you know, I work in an office. So generally when I walk in a patient room, the way I start the visit is, how are you and how can I help you today? And it's an open-ended discussion.
Right.
So maybe, Rabbi, we can start with you in your role at a nursing facility. Do you start these discussions, or do you come in sort of after the doctor? How does that work?
I think there's no rule to that. It really it depends on how people, residents or their families, are willing to face it. Like when it comes to issues of death and dying, it's a little bit what Woody Allen said, I don't mind dying, but I just don't want to be around when it happens. So people have different attitudes toward it. When I start the conversation with residents, most of them I do know for a long time, I often ask them, what's going on? And if the resident will tell me, Rabbi, I think it's my time, then I know I have a permission, I have an opening to talk about what it is, how one says goodbye, what is there. But if anybody, somebody will tell me, I have this problem or that problem, but they're working on it, then I know that they are not as ready for this conversation. Ultimately, a lot of people are comfortable to talk about it. And in cases, sometimes the families are the more reluctant one who don't want to.
Yeah, I've noticed that too. In that the patients are more than they're eager in some cases to talk about, as you just described. In fact, they'll bring it up, if not directly, then indirectly. And if you're listening closely, you as you say have an opening.
Right. Exactly.
But then sometimes the families object.
I mean, I have one resident in mind, and her daughter always visits with her, and the mother always says, there is a time that I won't be around, and the daughter is then constantly saying, oh, no, don't say this, everything will be good, etc. And so the resident asked me to intervene, and we had a very, emotionally meaningful conversation in the chapel, the three of us, and with lots of tears and lots of laughter, and it helped tremendously. The mother, it helped because she now felt that she actually can really talk to the daughter about what's going on. Not that she has any plans to get out of the game, but at least she doesn't have to pretend all the time.
Right. So I think that's really important, Rabbi. So in folks who are expert in this, so we are palliative care physicians or doctors like Zach, Dr. Pallas, and myself, who are geriatricians who might be skilled in palliative care. What happens is it's sort of like through the looking glass. So there, the case you just described, Rabbi, that you provided really some spiritual healing and psychological support, because the sort of this the sounds to me, the way I would summarize it is the mother needed help starting the conversation with her daughter, and the daughter, in trying to protect her mother, was actually causing pain, unfortunately.
Yeah. I mean, we have many situations when people are actually really at the end of life, at the deathbed, if you wish, that the families, they will be sitting next to, and the person say, you see, everything is all right, they have new medication, etc. And the moment they step out of the room, they start crying. And I cannot, emphasize how important it is that those tears belong to the bedside.
Yes.
In this respect, doctors, all of us who work with us, nurses, social workers, we can help people, model for people how to talk about this and how to be able to allow families and residents, as they are with us, or patients, to have the conversation.
Appreciate you so much for coming on, Dr. Zach Pallas and Rabbi Simone Hirschhorn from the Hebrew Home. Thank you for talking about end of life.